generally, we should learn to manage our stress levels, as individuals, because I know that is a difficult thing, because Nigeria today is, completely in a situation where we are socially challenged, economically challenged, and so the level of frustration is high. So,
yeah.
But we try to help them manage their level of frustration and stress, when they come to us in our clinics, so that we can also help them to, of course, manage their blood pressure levels. But I must also emphasize here that actually the optimal blood pressure, according to the World Health Organization guidelines, is ideally supposed to be a systolic blood pressure of 120 and a diastolic blood pressure of 80. There's what they call normal blood pressure, which is a systolic blood pressure that should not be more than 130 millimeter mercury, and a diastolic, that's a lower level blood pressure, should not be more than 85 millimeter mercury. Then, of course, you have what is called high normal. The 140/90 actually is borderline, and I think Nigerians should know this. Okay. Once it crosses that level, then begin to talk about the various grades of hypertension: mild, moderate, and severe. The severe one is when the systolic blood pressure is more than 180 millimeter mercury, and the diastolic lower one is more than 110 millimeter mercury, according to WHO guidelines. So it's important that we know this, that yes, sustained elevation of blood pressure of beyond 140/90 could predispose, of course, could make you come up with, could make you get diagnosed as having hypertension, but the ideal optimal blood pressure should be 120/80.
Dr. Saha, I just hope that some of these explanations will not get somebody hypertensive, because the information is loaded. Okay, now experts like you are also raising alarm over the presence of fake blood pressure measuring devices in Nigeria. Is it in Nigeria? Is it true?
Yeah, we are beginning to see cases like that. In fact, some of the preliminary studies we did, especially during our mass screening exercise, because the NMA conducts health missions every 4 months. And we had incidental discoveries of some of these equipments that were very faulty. And of course, if we were not experts, if we had no alternative, equipment to compare, to standardize, then of course we would have gone away with 40 BP measurements, and that of course will have meant either treating your patients wrongly or giving them, wrong advices. So I think the whole issue of standardization, within the Nigerian manufacturing, environment is very key in this respect, and that means that not before any facility gets into the Nigerian environment, there should be some level of checks and balances. The Standard Organization of Nigeria, together with even NAFDAC, must be up and doing to ensure that these equipments are well authorized before they come in. They are up to standard, international standards, before they are put to use on Nigerians. Otherwise, you have complications arising from, poor measurements.
Okay, now, what is the role of alternative medicine in all of this? Well,
I'm a scientist, and I honestly, I do not think scientifically one can attest to any.
Some have mentioned herbal remedies like moringa, olifera, zobo, and...
well, it's left to NAFDAC to evaluate, these drugs through clinical trials. Part of the challenge we have now is that all sorts of drugs are being masqueraded as cures for even hypertension. Hypertension has no cure, and that must be made clear to Nigerians. Hypertension has no cure, so if anybody comes with any medicament, yes, manage over a long time. And that is why the issue of awareness creation is very key. So there is no drug right now in the whole world that can cure hypertension. At best, what we do is to manage the forces that control hypertension in terms of the cardiac output and the total peripheral resistance.
Now, how do people already having complications care for themselves or be cared for?
Well, that is why you need to see your doctor. And increasingly in Nigeria, we have now what we call family physicians, family doctors. So Nigerians are encouraged to, of course, have access to at least have a family doctor to their family, looking after their conditions. So before it gets to that stage of complication, of course, we expect that the individual would have been seeing his doctor. And if you have the right management principles applied, hardly will you have complications arise. But where complications have arisen, then of course there are several levels of management by experts in the different fields of medicine.
Okay, now the opposite of hypertension is low blood pressure. What is the difference between the two? Are both dangerous, so is one more dangerous than another?
Yes, certainly both of them are not what we want to have happen to our patients.
What causes that? What is the cause of that one?
Well, different things can cause it. Essentially, what you're having is a reduction, in the blood volume, which can, of course, reduce the level of blood pressure, because what you're having is arterial capacity and pliability is actually what is involved in the whole mechanics of determining the blood pressure, meaning arterial pressure of any individual. Now, when you have increased volume, for instance, the tendency is to have an increased blood pressure.
Yes.
Now, when you have things like conditions that will reduce the volume of blood in an individual, for instance, when you have hemorrhage, of course, you're going to have hypotension, a reduction in the level of blood pressure, either in the systolic or below the normal expected value, and of course the diastolic, and of course that will predispose the individual to hypertension. There are other causes that can predispose a patient to hypertension, including even infections,
yes,
that can predispose an individual, towards having hypertensive crisis.
Now those who have stroke as a result of hypertension, what is your advice to them? How would that be managed? Well,
they should visit in cases where it had already occurred, I expect them to visit their doctor, because it's only in an authorized medical facility with the right component of experts, specialists, to attend to that kind of case that you can get the best of care. And of course, in the health system, we drive multidisciplinary teams. And so a case of severe, what is commonly called stroke, is one that requires multidisciplinary care approach, team approach. And the doctor certainly is the one that coordinates that management approach. So I expect that if such an individual happens to develop cerebrovascular accident, whether in the mild form or in the severe form, I expect the person to be taken to the nearest facility for management.
All right, Dr. Osaho Nabulele, you have actually educated us and the entire Nigerians on this very issue. We'd like to thank you at this point for sharing your wealth of knowledge tonight on Weekend File. Thanks, and we hope you come again.
Let me also say that we have called on government really to declare public holiday for medical checkups for Nigerians. Nigerians need to be given that level of incentive to go on their own to have these medical checkups.
Okay.
At least one public holiday in a year for Nigerians to do their checkup with some incentives.
All right, thank you. Thank you. Dr. Osaho Nabulele is the national president of the National Nigerian Medical Association, and he has actually educated us. Thank you once again.